Hi, I'm Matt Willis, Public Health Officer with today's COVID-19 update. Last Friday was the 100th day of our pandemic response activation here at the Marin County Emergency Operations Center, centered at the Sheriff's Office. This week, we took another important step. Our storefronts reopened for business indoors and house cleaning services have resumed. Looking back at the past 100 days, we've all lived through an unprecedented change in our daily lives across the nation. In California, we've moved slowly from high-level policies by the governor and the local shelter-in-place orders, which flattened the curve. Over that time, we also built surge capacity in our hospitals, increased our testing and contact tracing capacity, and, most importantly, we learned what it takes to protect ourselves and those around us. We now have a better sense of the treatments available to us, including convalescent serum and remdesivir. 2 of our recent survivors in Marin have been treated with drugs that had not been available before. As we move through phase 2, we're moving away from policies that are restrictive and more to individual responsibility. June 29th, we're anticipating the reopening of restaurants indoors, hair salons and barbershops, hotels, motels, short-term rentals, and gyms and fitness studios, all with modifications to ensure safety. Limiting the spread of COVID-19 will rely on the behavior of each of us. As you navigate choices of your own, here are the most important principles to think about. First, remember that the risk of infection is based on the duration and proximity of exposure to someone who might be infectious, particularly if the exposure happens indoors and in poorly ventilated areas. Close proximity, indoors, and without face covering is the highest risk. It's best to assume that both you and the person you're interacting with outside of your household may be infectious. Covering our face and keeping at least 6 feet apart between us is something we do for each other. Second, be conscious of your own risk. People who have medical conditions, including common chronic conditions like diabetes, or older adults, should take this into account in their choices to venture out. If you're in a higher risk category, you might choose not to visit a restaurant or shop indoors, even though these things are allowed. Through Marin Recovers, we have worked with business owners to ensure that they're following the standards established for safe business practice. And all should be posting their site-specific protection plan in plain view. Our businesses take protecting you and their own staff seriously. But if you feel as though they're not performing or following safe practices, this might be a business to avoid. My greatest concern as a public health officer as we reopen is that people will mistake reopening for safety. In fact, we are more vulnerable than ever because the virus is part of our community. As we roll forward with reopening, a greater share of the responsibility for controlling this pandemic is in your hands. Thank you for doing your part. It's so important for each of us to cover our face, stay 6 feet apart, and understand our individual risk to make informed choices. When we successfully flattened the curve, we demonstrated how powerful we can be when we're committed to the same goal. We need to be even more committed as we venture further forward for our own health and also for the health of those around us. Thanks again for doing your part, and stay healthy.